Hello everybody and welcome to another episode of Rotator Cuff Expert. I'm Dr. Orcutt. Today we're going to do something a little bit different, nothing that we've actually done like this before. Sorry, that's my dog. So anyway, today we're going to talk about post-op, but we're going to talk about how to create a notebook for us to better track your progress and better be able to communicate with your physician afterwards. If you don't know, right, we have Rotator Cuff Expert, that's where you are in the YouTube channel, and also on mybodyprotector.com. So that's the blog and the website that we have additional information here. But today we're going to talk about how do we create a notebook that we can translate our information, how we're doing after surgery, to our doctor, because lots of times we forget, or patients that I see forget information, they forget questions they want to ask. And lots of times a notebook will help us, help you organize your thoughts, so when you see your doctor post-operatively, that you can make sure you're touching on things that are important to you. So the first thing that seems to be most important is pain. So what we'd like to do is be able to have a notebook where we talk about pain in certain time frames, right? Pain in the morning, pain in the afternoon, pain in the evening, right? Pain is typically worse at night. So if we're requiring pain medicine at night, then that's important for us to know if we're requiring pain medicine during the day or pain medicine in the morning. And as we go along, each day we should have our information about morning, noon, and night, or morning, afternoon, and night, about what we're taking, because in the beginning we expect we're going to take a bit more, and as time goes by we should take less and less. So that's important for you to be able to see as a patient. That's also important for your doctor to be able to see. So pain is important, and then pain medicine is important, right? Again, if you're taking pain medicine every 4 hours in the beginning and you're beginning to taper off, that's good for you to know, for you to have confidence that you're getting better. It's also good for your doctor to know, because when you come back in for your first post-op visit and you can say day 1, day 2, day 3, day 4, day 10, this is what I'm doing, this is how much pain medicine I'm taking, then the doctor can understand why you might need more or maybe not need more, or what you're taking specifically. So I think pain, the level of pain, we usually talk about in medicine terms, 0 as being none and 10 being pass out, it's so bad. And about what medicines you're taking. Are you taking the narcotics? Are you taking just an anti-inflammatory? Are you taking Tylenol? All those things are important for us to know. And so we need a notebook or a sheet of paper where each day we say, this is what we're taking, and this is when we took it, and this is why we took it. So it's really important for you as the patient in recovery, but also important for the doctor to know. And the next thing is diet. How is your diet? What are you eating? Are you eating what you normally eat, or are you not eating what you normally eat? Lots of time narcotics will decrease your hunger, so you might be taking less. And it's important for us to say, and as far as diet, also drinking. How much are you drinking? Are you drinking enough water? Not enough water, because hydration is really important in recovery. So we want to make sure we have a place for hydration. And diet, how much you're eating, is it normal, not normal, and how much you're drinking. Is this about what you don't drink, drinking less or more? Because that's important for us to make sure you're getting the right amount, right? The right amount of calories, the right amount of hydration. And another thing, we talk about exercise. How much are you exercising? So what were the plans for you after surgery? What were the plans for you to do? Were you supposed to exercise in certain ways, 3 times a day, 1 time a day, 0 times a day? Were you supposed to just be in the sling and do nothing else? Either way, whatever that plan is, we want to document that plan each day. Today I did this, today I did this, today I didn't do anything because I'm waiting for the doctor. And that's important for the post-op 0, which is the day of surgery, to post-op day 10 or 15 or 14, whatever. When you see your doctor, we want to see that. And then after the first post-op visit, there may be other things that change, and then you can write down in your notebook, this is what I'm doing now. So this is the new thing I'm doing. For me, lastly, is digestive. How are your bowels doing? Now, this is a kind of a hard subject to talk about, but lots of times after we have surgery and we take narcotics, we get constipated. So we want to make sure that we document that. And so you say, Doc, I'm throwing up, right? I'm nausea all the time. Or Doc, I'm constipated. Or I have diarrhea, whatever. Important for us to comment the digestion, because sometimes that gets missed, right? There's so many big things, and then you might go home after your first visit and go, oh, I forgot to say I'm this or that in my digestive system, so it's important for us to have a notebook that has all these things in here. So when we go to the doctor, we can go, here it is. This is what's happening. And that way you have an organized plan for what to tell your doctor. So what I'm asking my colleagues out there, what I'm asking my friends out there, patients out there, people who are subscribed or people who don't subscribe, if there's things that you can think about that might be good to go in a notebook for the first probably 5 or 6 weeks, maybe 3 months max of after surgery, of the things that you think, man, I wish I would have remembered to ask my doctor this or that. I wish I had a place in my notes to write this down or that down. Please, please, please include that in your comments, because I'm trying to make something that's going to be good for all of you, all of us after surgery, so we can maximize a recovery, because that's what we want to do. This is a hard thing. Shoulder surgery stinks. It's hard, it hurts, it's hard to get through, it's stiff, and it's all this stuff that is not very much fun. So we want to do our best. If we're going to have to go through this, we want to do our best to maximize the recovery. And one way is having a notebook where you can list all these things that you need to keep track of, and therefore all these things you can actually communicate with your doctor and not go, oh crap, I forgot to ask that. Because as you know, and as I know as a doctor, you might forget to ask that, and then it's really hard to get that information. Even if you have a direct line of communication with the doctor, it's still hard to get those questions answered when that person is not right in front of you. So pain, maybe 3 times a day, morning to night. Meds, what are you taking? Are you taking narcotics? You're taking over-the-counter stuff? Important for us to know. Sleep. How are you sleeping? I don't think it says. How are you sleeping? Where are you sleeping? Are you getting any sleep at all? Because we may be able to help that. We may be able to adjust your medicines so that you can sleep, because it's important in recovery. Diet, what are you eating? How is it going? Are you nauseous? Exercise, what are you doing for your exercise? Are there any exercise you're doing or not? And then digestive. Are you having constipation? Are you having nausea? All those important things. Plus, what else you guys add into this will be really helpful as we try to generate something that will be helpful for everybody going through this recovery. Anyway, thanks so much for your time. Please like, please subscribe, please go to the website. We'll do everything we can to make this process as painless as possible. Thanks.